Welcome to the Peaceful Parenting Podcast. I'm your host, Sarah Rosensweet, mom of 3 young people, peaceful parenting coach, and your cheerleader and guide on all things parenting. Each week, we'll cover the tools, strategies, and support you need to end the yelling and power struggles and encourage your kids to listen and cooperate so that you can enjoy your family time. I'm happy to say we have a great relationship with our 3 kids. The teen years have been easy and joyful, not because we're special unicorns, but because my kids were raised with peaceful parenting. I've also helped so many parents just like you stop struggling and enjoy their kids again. I'm excited to be here with you today and bring you the insight and information you need to make your parenting journey a little more peaceful. Let's dive into this week's conversation. Hey, all, welcome back to another episode of the Peaceful Parenting Podcast. Today we are talking about ADHD and eating or feeding, or however you want to think about it. If you have ever felt like the division of responsibility in feeding or intuitive eating did not work or does not work for you or for your child, and you suspect that you might have ADHD, or maybe you don't, but you still are interested in looking at food and feeding a different way, then this episode is for you. I know that I have talked to lots of families who've said, we are practicing the division of responsibility in feeding, and my child never seems to get the signals that that's enough. I got really curious about this, and the more I looked into it and actually talked to Dr. Olivardia after my summit, after we had finished recording, he was one of my summit guests, and we started talking about this because one of his specialties, and if you didn't realize, he was one of my summit guests talking about ADHD. He was fantastic. And we started talking about this topic of food and eating and ADHD, and I knew I wanted to have him back to talk about it. We do discuss eating disorders during this interview, so please take care while listening. This was such a great interview. I learned so much, both personally and professionally. I love talking to Dr. Olivardia. He is so funny and so interesting. So I hope that this is really informative for you, and you come away with some ideas that encourage a healthy relationship with food and with eating and with our bodies. And it's a little bit different than some of the things that we've been reading about. We still want everyone to have that great healthy relationship with food and bodies, and with the way that we might have to get there if we have ADHD or our children have ADHD is a little bit different. Or even if you're just interested in, some other ideas around food and eating, then this might be a great episode for you. If you know anyone who's told you, oh my goodness, I've really tried to do the division of responsibility and it just didn't work for my family, send them this episode. That might be that this really resonates for them. So let's go ahead and meet Dr. Olivardia. Hi, Dr. Olivardia. Welcome to the podcast.
It's great to be here. Thank you for having me.
Yeah, I interviewed for you for our summit last year, and it was one of our favorite summit conversations when I got feedback from everyone, and I super enjoyed talking to you. So I'm really happy to have you on the podcast and introduce you to a wider audience. So thanks for coming on. Can you tell us a little bit about who you are and what you do?
Sure. I am a clinical psychologist and a lecturer in the Department of Psychiatry at Harvard Medical School in Boston, Massachusetts. I was born and raised in Boston. I have a private practice in a suburb of Boston, Lexington, Massachusetts, where I specialize in the treatment of ADHD, people of all ages, but particularly people with ADHD who have what we call a comorbid or associated condition. So people with ADHD who also have depression, who struggle with addiction, who have eating disorders, which we'll talk about today, or bipolar disorder. Also work with individuals with obsessive compulsive disorder, with body dysmorphic disorder, and have a specialty in working with boys and men with eating disorders. That's something I've done for 30 years and co-wrote a book many years ago about that, and have done a lot of research in that, and then loves presenting at podcasts and conferences to share all this information to educate people about.
Well, it's great to have you. And yeah, what I wanted to talk to you today was about ADHD and eating and eating disorders, because I think that there's both like challenges with eating that don't necessarily turn into an eating disorder, but maybe we will be able to talk about both. And my particular interest in talking to you about this is through my practice, I've discovered that through talking to families and in my own personal life, I've discovered that the recommended way that parents feed kids, which is what we often recommend, and tell me, you may not have heard of this, or maybe you have, but the division of responsibility in feeding, which was developed by Ellen Satter, which is, just for people listening, it's basically parents decide what kids eat and when, and the kids decide if they eat it and how much. And it's especially the how much part that I found just doesn't work for some kids. That there are some kids, and you and I talked about this a little bit on the summit, but there are some kids who don't have that off switch that is expected for a typical child, where they're like, oh yeah, that's enough Halloween candy for me, or that's enough pizza for me, or whatever. And it's been very tricky to navigate that, in my own family too. It's been tricky to navigate that pressure to do like intuitive feeding or responsive feeding or intuitive eating with somebody who is neurodivergent, and that doesn't necessarily work for them. So that's my own interest in talking to you about this. But before we specifically dive into that, maybe you could just tell us a little bit about that co-occurrence with ADHD and eating disorders, and a little bit about that spectrum and what you see or what the research shows.
Sure. I mean, first, just, with your example, and one of the other things that's so important, honestly, in my description is I'm somebody who has ADHD and lived experience, and I am a parent of 2 kids with ADHD and dyslexia, almost 19 and almost 17-year-old, which to me is probably should have been the first thing I said in introducing myself. But that particular example with Halloween candy is a great example, because as someone with ADHD, it would shock me when I would have friends that would have their Halloween candy into end of November or December. I remember having a friend that after New Year's still had their Halloween candy, and I'm thinking, what are you talking about? Mine went within the week. I mean, it was, bam. And your point is so important, and for parents too, because like we've talked about with the summit, when you have a neurodivergent child, and here we're talking about ADHD, the parenting books and the parenting rules, they need some adjustment, and we need to sort of be flexible. It's not a one size fits all, frankly, for any child, but particularly for an ADHD child, a lot of those things aren't going to work. And to me, it's so important for parents to know that, so that they don't feel like they're failing in some ways, or they're not doing it right, or they're like, oh, I'm letting my kid get away with everything by not allowing them to stand up while they're eating dinner. That might be what we need to do. So just like we're trying to instill in our children this idea of flexibility and advocacy and knowing what's going to work for you. And my motto is, as long as you're not hurting yourself or hurting anyone else, all bets are on the table. And as someone with ADHD, I did very bizarre, unconventional things to get things done and things like that. So here we're talking about eating, which is, obviously something we have to do every day, multiple times in a day. And one of the most important things to understand with ADHD is that it affects every life domain. It is the lens by which people sort of kind of are oriented, frankly, to the world. So when you think of eating and what healthy eating incurs, it requires a lot of executive functioning to even be aware. And this is why we see these issues sometimes, or we know from research that we see higher prevalence of obesity, higher prevalence of eating disorders such as binge eating disorder, which is the most common one that we'll see with ADHD, which includes individuals who might engage in binge eating episodes where they're eating a tremendous amount of food in a short period of time, very quickly, sometimes to the point of being very uncomfortably full, really lack any sense of control over it, which is very different than somebody who's overeating but feels kind of in control, but they just love it. And they're like, I just love this, a lot. With binge eating disorder, it feels almost just, again, very out of control for the person. It's often happening in secret where people are doing it alone. Bulimia nervosa is also could be high. People with ADHD have higher risk factor. And that's basically somebody who's engaging in binge eating episodes, and then compensating, and I should put that in quotes, for the binge by either self-induced vomiting, laxative use, diuretics, fasting. Now, I say compensating in quotes because for what people need to understand is when somebody is purging, like we're not meant to vomit after every meal. We're meant to vomit only when we have a toxin basically in our body. So and the body is really an amazing evolved, mechanism that tries to keep us alive. And what we know for people who have struggled with bulimia is that the more that somebody is purging, the more your body will compensate by holding on to the fat of whatever you ate and the calories. So when people are purging and they think they're neutralizing or compensating a binge, they're really vomiting water primarily, and then a lot of vitamins and minerals. The fat is the last thing, if at all, is going to go. So most people actually who struggle with bulimia are overweight or not underweight in what we would see with anorexia nervosa, which is
Can we just highlight that for a second?
Sure.
Because I think there's a lot of misconceptions out there that somebody has to be dangerously thin to have an eating disorder. So I just wanted to highlight what you just said, that somebody can be, heavier and have an eating disorder as well.
Oh, 100%. And bulimia in particular it's a more secretive disorder because, people are eating and people might be seeing, but people might not realize that person is purging, after every meal. And, anorexia, which is where people are basically severely restricting calories or starving themselves, that can often be more identifiable if someone is emaciated or very thin. But what is so important to underscore, the mortality rates are the same for people for anorexia as for people with bulimia nervosa, because particularly with laxative use and self-induced vomiting, that can put a lot of strain on the heart and is associated with high cardiac risk and cardiovascular events. I've had patients as young as 20 who have had heart attacks because of bulimic symptoms. And there is also a high rate of suicide in both of those populations. So absolutely, just because somebody is in a larger body does not mean that there's significant damage being done to them medically because of problems.
Is anorexia also associated with ADHD, or is it mostly the bulimia and binge eating disorder?
Yes. So it's mostly with binge eating and bulimia, because though even in the field of eating disorders, we call them all eating disorders, but they're kind of different entities in a lot of ways. The bulimia and binge eating are more impulsive and more impulse control related. Anorexia, now I have treated, I specialize particularly with boys and men with eating disorders. I have treated boys and men with anorexia who have ADHD. The disorder we mostly will see with anorexia is OCD, obsessive compulsive disorder. That anorexia is sort of in that family where it's more compulsive, somebody who's like restricting. And bulimia and binge eating is almost like a spilling over the boundaries and very impulsive. Now, I have worked with people who were bulimic or had binge eating disorder, and as ways of compensating for that, thought, and people with ADHD can be very all or nothing. Well, either I'm going to eat everything or I just have to eat nothing, and then collapse into an anorexia, or something called ARFID, which is avoidant restrictive food intake disorder. And that disorder is meant to sort of capture individuals who might not fit neatly into the criteria of anorexia, bulimia, binge eating. Anorexia also is typically marked with body image issues, but it's also important to understand not everyone with anorexia will have fears of gaining weight or being fat. I mean, sometimes, and particularly with neurodivergent individuals, because I should also say, other than OCD, there's a high correlation of autism spectrum. And what used to be anorexia now we understand is more ARFID, of sort of sensitivities to certain foods. Kids on the spectrum might only want to eat 3 different foods: macaroni and cheese, bread, and pizza, and that's it. And so they're malnourished. I mean, they're eating, but they're not getting the true full nourishment. So eating disorders and disordered eating can come in many different forms. But for ADHD kids and adults, typically you'll have higher risk of binge eating, bulimia, ARFID, and then obesity, which is, obesity is a whole other thing where it's not everyone who is overweight is eating too much necessarily or binge eating. It's sometimes the kinds of foods that people with ADHD are attracted to, and some of the things that you were talking about, that sort of lack of a pause button. And that's what we also find just with eating in general, that studies will show that people with ADHD tend to be less intuitive. So there's a term called interoceptive awareness, which is basically how mindful we are to what's going on in our bodies. So to know, am I hungry? Am I satiated? Do I have to go to the bathroom? What am I feeling? What are my emotions? Am I tired? All of these things require interoceptive awareness. And I'm sure anyone out there, and you as well, when you hear all of those things like, oh, yeah, check, 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 check. People with ADHD have trouble sleeping. Kids with ADHD have a higher risk of being bedwetters, emotional dysregulation. I mean, all of these things we have to be in the present moment and determine that does not come naturally for people with ADHD. And I'll share a humorous example from my own experience that I remember 10 years old being at Chuck E. Cheese, which at that time was super cool to have a birthday party at Chuck E. Cheese. Now it's like mayhem. One of my friends, now pizza's I love food. I should start out by saying that. And I love pizza. And my friend had a birthday party there. We ate pizza, played arcade games, and my friend's mom said, oh, guys, I have a lot of leftover pizza. Like, eat it up. I don't want to waste it. And I remember this kid at the party who was like, oh, no, I'm good. I'm full. And I, in all honesty, looked at him. I'm like, oh, you don't like pizza? And he said, no, I like pizza. I'm just full. I'm like, oh, you don't like this pizza, like Chuck E. Cheese pizza? And he's like, no, I liked it. I'm just full. And when I tell you, I could not wrap my head around. I'm like, oh,
you didn't
like
understand what he was talking about.
It was like he was talking a foreign language. And he looked at me, and I mean, he looked, I remember the look on his face, like as if he was saying, what don't you understand about this? And what I didn't understand is I love pizza. It's in front of me. I'm hungry. It's there. I'm going to eat it. Like, what do you mean you're full? Like, just like the Halloween candy, I want candy. It's in front of me. And studies have shown this. There was a great study that was done, which looked at kids with ADHD between 10 and 14 and compared them to kids without ADHD. And they assessed their mood, their hunger level, the food they liked and disliked, and basically put them in a food lab. And they were allowed to eat whatever they want, how much they want. They were just observed, and everything was monitored. And when controlling for all the variables of level of hunger, of when they ate their last meal, what food, the kids with ADHD ate significantly more. But what was interesting is that they ate more. It was not based on their level of hunger, and it wasn't even based on the foods they liked. So kids with ADHD ate more of foods they didn't even really like. And when they were asked, were like, it was just there. Like, and I joke and say, like, it's like the seafood diet. Like, if we see it, we eat it. And that has shown itself in other studies with adults, that the people with ADHD were so externally oriented by cues that it's almost like, well, if it's in front of me, we could substitute food for video games, for the internet, for, social events, like that fear of missing out, like whatever it is, it's like, oh, I'm not tired because my friends are up and having fun. So I'm not tired. Like, that was in college. Like, me being tired meant there was no more fun to be had or nothing productive left to do. Now I'm tired. Same situation with sleep. I remember people being like, oh, I'm going to leave this party because I'm tired and I have to wake up early. I'm like, oh, but you're having a good time and you're leaving? What?
I can totally relate to that. And for me, and it's not necessarily true, but it's always a sense that if something is good, more is better.
100%. Absolutely. Mm-hmm. And food, it's a tough thing because, we also know that people with ADHD are more rewarded by sugar and by simple carbs. And so as opposed to the other way around, like sugar doesn't cause ADHD, sugar doesn't necessarily make people more hyperactive. I mean, certainly if you have kids at a birthday party and they're eating lots of sugar, they're wild because it's 20 kids at a birthday party. However, a point to be made about that is nutritionists will tell you it's not just the presence of sugar, but if they're eating a lot of sugar, they're not having enough protein. They're not having enough of those other more sustaining nutritional needs that do and can actually sort of mitigate, some of that hyperactivity. So
can you say more about
individuals,
being rewarded? Like you just said that they're more rewarded by sugar and simple carbs.
yeah. So studies show that sugar can have a dopaminergic effect on the brain. So what we know about an ADHD brain in a nutshell is we have all these neurochemicals in the brain, and one of them is dopamine. And dopamine is implicated in reward. It's implicated in motivation. So when we get a good dose of dopamine, we feel stimulated, but stimulation gives us a feeling of presence. Like we feel present, we feel in the moment, we feel grounded. And so we are rewarded, and all of us, by whether it's a fun event or good food or being in love, all of these things kind of raise levels of dopamine. And then there are unhealthy things like certain drugs and food and things like that. And unfortunately, it's not the food that is the healthy, like kale does not increase levels of dopamine in the brain.
That it would.
I know. I wish, but it was very clear to me as a young child and growing up in a household where there was no sugar cereals allowed, no soda. I mean, thankfully, at the time I was griping about it all the time, but even though I was not diagnosed as a kid, what we knew about ADHD in the 70s is not even close to what we know now. But my parents, they knew who their kids were. They definitely knew who I was, but didn't stop me to go to my best friend's house next door, and he had Lucky Charms and Count Chocula, and I would put sugar on that cereal. And even my best friend, who clearly had ADHD, he'd be like, that's Frosted Flakes. Like it has already sugar. I'm like, to your point, you can never have enough. What are you talking about? It became very clear to me what my sweet tooth, I had a much higher level before I felt it was like too much. And that's not just with food. That's with a lot of things in my life. And we know that people with ADHD, we carry a higher risk of addiction of anything. And so whatever we love, we run the risk of loving too much in that way. And food is in that category. And there have been many times that, whether it's sweet things or even just portions of things, that my shutoff valve was not working the same way that it would for other people. So now if you think of this on a larger scale, if you have individuals with ADHD who are more impulsive with their eating, where executive functioning wise, especially as adults, to plan healthy meals means you have to think about, if you want dinner ready at 6:00, you have to think about it maybe at 9 a.m. because maybe meat has to be thawed. Maybe you don't even have the ingredients and you need to go to the supermarket. And I work with so many adults who feel, especially parents with ADHD, who feel so guilty because they're like, oh, I didn't even think I didn't have this. And then we just ended up going fast food. And that happened 4 nights a week. And then they feel guilty and they're not eating nutritiously. But it's important to understand it from that context that healthy eating requires a certain level of executive functioning, requires a certain level of emotional regulation, of that mindfulness. And when we get bored, it's so easy to eat. Food is accessible. It's legal. It's around us all the time.
And
so
it gives that dopamine.
Exactly. Easy dopamine. And so with a lot of my patients, it's really kind of having them learn those interoceptive awareness skills of how do I know, like, I'm actually hungry versus I'm just bored in that way.
I want to sorry to interrupt you, but I want to go back to something you said before we get too far away from it. And I want to hear about the learning the cues. But you said in your family, there weren't sugar cereals and soda and, whatever. Some people who are big on the, responsive feeding and the division of responsibility would say, aha, like that's why you binged on it at your friend's house when you had the chance. And that's one of the particular pieces that I feel is what I wanted to talk to you about. Do you think do you have any siblings who don't have ADHD who are just fine and they can like take it or leave it with sugar, even though they didn't have it when they were growing up? Or what do you see in terms of your experience and your research with that? So yeah, just if you could tackle that.
So I have 2 older siblings. We all have ADHD, and it manifests in different ways. I would say they are much better about that and more regulated than I am. My ADHD is definitely the more hyper impulsive. I have I with full knowledge know that if I did have sugar cereals, I would have cleaned it out. You know how I know that? Because if I bring in a sugar cereal now in my house, it will be out. If I bring a package of Oreo cookies in my house now, I can easily rip through them. I mean, and I'm an adult. I have access to get anything I want. I think in a lot of ways, and this is where it can be tough sometimes for people to really look at food in this way. But if, we were talking about alcohol, for example, and someone who's really struggling with alcoholism, we wouldn't say, well, we should have wine in the house. Now, I'm not advocating, and it's so important. There's no blanket statements here. Like, I would not say to parents, never have sugar cereals in your house. It all depends on who your kids are, being mindful of, all of these things. It's never a either or thing, but I know for me that absolutely, because I mean, my parents would buy orange juice. I'd slurp down that orange juice. Like, it was just out of style. I mean, my popsicles were, cranberry juice my mom would put in like these molds. And
yeah, same.
even that, I mean, granted, it's better than some of those, but I'd eat like 6 popsicles. Like, It's just, I'm a consumer, like in a lot of ways. I mean, in ways that I like about myself, like I love taking stuff. I'm a big music lover. I like to take it in. I like it. But this is something I remember my mom saying to me years ago, that even as like an infant or toddler sitting in a high chair, that, she'd put out the little bites of food, and, I'm the third. So she had a lot of experience with my siblings. They take a bite, they eat it, they chew it, they swallow it. She said, I scooped all the the bites up and shoved it in my mouth and almost choked. And she knew we need to sort of parse this out. We need to put one at a time. And so this is where, again, for now, could that be the case for some people, that if they never had sugar cereal, maybe it makes them crave it more? Perhaps. I mean, that's where I think you have to kind of monitor that, like how they feel about it. I mean, it wasn't that they were like, if we were out of the house, we get an ice cream or, things like that. It's not like I was deprived of every sweet, dessert. But
I guess my thought, what I've been realizing, is that some kids with ADHD, even if you follow that, responsive feeding, intuitive eating, they're never going to get the, oh yeah, that's enough chocolate for me, mom. Like and it makes those parents feel like there's this tension between everyone, all the experts saying, this is how you should feed children, is like, expose them to a lot of things, let them have as much as they want, and they'll learn to self-regulate. And then when you see that your child is not self-regulating, even though you've been practicing this, then there's the guilt of, well, if I tell them they're eating too much, I'm going to give them an eating disorder.
Yes.
And I'm going to make them feel shame about food. And so there's that tension between, like, how do you help a kid who doesn't have that off switch that maybe a neurotypical kid might have, and then not make them feel bad about what they're eating, or send them the message that they're eating too much, and give them some sort of complex about food, and, worry about being in a bigger body.
Yeah. And this is something I hear from parents all the time. And I get it, because, being working in the eating disorder community for 30 years, that obviously I'm very aware and sensitive to how do we talk about food and bodies and those things, and to either to ourselves as well as to our children. How do we talk about our bodies in front of our children, and knowing that our kids are absorbing lots of things. And where I do disagree, perhaps with, if someone is looking at it just through that lens and not incorporating an ADHD lens, is, to me, and parents are not meaning to do this by any means, but I can unintentionally have a child feel often more like a failure or defeated, that you're saying, hey, you have it in you to determine when it is enough. And if they don't do that, then they're thinking, well, I've been tasked with this responsibility that I should know when it's enough and I don't. So what does that mean? And I hear from the kids a lot that they feel worse in some ways. And of course, that's not what parents want them to feel, by any means. And so I think that there's the discussion that it really could start at a very young age. And I certainly with my kids is, and it doesn't have to be about food. It could start with Legos. It could start with TV shows. But I wanted my kids to know the way we are, if we like something, we can like it a lot. And that's awesome with a lot of things. I said, Daddy loves music. I can listen to it. When I'm at a concert, I feel like I'm at home. It's just, and then there are things that Daddy might like that it's like, okay, I love, good Oreo cookie but I have to sort of watch that, or I like watching TV, but I have to go to bed at a certain time. And you can couch it in this language where it doesn't even have to be about food. It's just this overall sensibility. And then with food, growing up with a sense of engendering a positive relationship with food, because I grew up in a household where food is part of our culture. So we loved food. We are passionate about food. We would comment about, oh, this tastes good in this way. And we talk about food in very passionate ways. And so I was never given the message that we should not like food. In fact, my mom, she was from Brazil and grew up very poor. To be able to eat is a gift. To be able to eat is like a luxury. She knew what it was like not to have that. And so you don't take food for granted and those kinds of things. And how do we regulate that? My parents made us eat a small salad before we ate, our dinner. And I was like, oh, this is so why do we have to, do this? And, and I would just sometimes just eat it really fast just to get it down. But they were sort of engendering these kinds of habits, basically of, here's some sort of, and not that my dinners were unhealthy, but this is, healthy food. And it's a way of kind of filling you up a little bit, but it's letting and talking to our kids of, oh, I like that. I love that you love spaghetti and meatballs because I love making that for you. And I love when, you are enjoying it. But if we eat too much of it, are you really enjoying it? And this is where that interoceptive awareness comes in, because as opposed to saying you're eating too much, period, as if something's wrong with you, you have no willpower on any of that. It's no, I want you to enjoy food, but I also know if you eat too much, you're saying to me, oh, I feel sick, or, I'm constipated, or and then it's well, then are you really enjoying it? And I'll do these exercises with adults where what's the, if I love pizza, I'll have a slice of pizza. It's, oh, so good. Is one going to be enough? Not really. If there's more, I'm going to want a second, and the second tastes really, really good. Now, when I have that third, is it going to taste as good as the first and second? No. For me, I start to notice a little bit of a dip. And then the fourth, definitely more of a dip. And in the past, I could eat more than 4 slices, and it's really not really elevating that dopamine in the brain. And so then it's oh, not only because it's too much and there are consequences to that, but I'm not really even enjoying this. I'm not really. And then when you put it in that language, it's still cultivating this positive relationship with food and saying, hey, I want you to, enjoy it. But if you're feeling uncomfortable, in your body, and if you're someone that, you're fatigued after you eat, well, then that's not really good, because you love to run after dinner, or even playing your video games, you feel like you're not as mentally sharp, then it's not good. Or you might feel bad that you ate all your Halloween candy a week later, and then you wish oh, I wish I could save it my friend John could, because then I could, how much did I need to have 5 Snickers bars in one day? Maybe it would be better to space it out. So then you're helping them see it's satisfying their goals, to sort of have more of that kind of executive functioning and mindfulness around food.
Yeah. So getting curious about how is this making you feel like with each through the process, and also a little bit of future planning. It sounds like it reminds me of, the Jerry Seinfeld bit where he says that night Jerry likes to stay up really late and that it's morning Jerry's problem. Right.
Yeah.
So I think about that all the time with ADHD is like living in the now versus like, how am I going to feel about this decision that I'm making tomorrow or in an hour? And that can be really challenging because the now, I mean, at least for me, like the now is so ever attractive, right?
It's all that exists. Exactly.
Mm-hmm.
Absolutely. But even those kinds of exercises of how do you think you'll feel even 10 minutes after you eat something? And it's like, like how, and then there's sometimes people like, I think I'm going to feel great. And it's like, okay, then at least you've thought about it though. Because, when I work with patients, even patients that are overweight, that are looking to have healthy weight loss, my goal is not to help them lose weight. That my goal is to engender mindful habits and regulating things. And then their bodies are going to do what is meant to happen, in that way. So when somebody comes to me and they say, I'm not happy that I'm 60 pounds overweight and I'm pre-diabetic, and at the same time, I love food and my doctor's just saying, eat less. And that doesn't, and we know with ADHD, the messaging basically is like, just do it. And we've heard that in so many different forms about everything from getting our homework done to whatever. And it is important for physicians, for allied health professionals to understand when you're working with someone with ADHD, there has to be sort of more of, a sensitivity, as there should be, again, with anybody, but particularly with an understanding of why this might be hard and how sometimes the rules just might have to be a little bit, different. So even like I have some patients that do not go to a buffet, for example. And I remember the first time, because we rarely went out to eat, my mom was of the belief like, well, one, it was more expensive to go out to eat. And she'd be like, oh, they dropped the steak on the floor and then they put it on the grill and I could make it better. My mom could. She was an amazing cook. But I remember the first time I went to a buffet and I was in college. I mean, the dining halls is kind of a buffet, but the food wasn't that great when I was in college at the time. But one of these like buffets, like $15, all you can eat. And there was, I don't know, probably 120 different food selections. And my friends and my brother was with me, and most people, and now unbeknownst to me, I wasn't even aware of this until after the fact, but most people maybe got a little sample of 20, 30 different selections. I got a sample of 100 selections. I mean, but it was not like I'm putting this all, like I did not even experience myself as like loading my plate. I just would, I'm going to take a little of this. I'm going to take a little, because I love all that novelty in my mouth. I mean, all of that experience, I'd sit down, I'd eat it. I didn't even feel like I was eating super fast. Then I'd get up and I get more. And at the end of the buffet, when we were leaving, I literally couldn't even move out. I'm like, guys, I have to like sit here because I literally feel like the food is up here and I'm going to like vomit, like just involuntarily. And they were like, well, of course you ate like everything. And I'm like, really? They're like, they were like, where does that even go? Like how, now when I was younger, I had a super fast metabolism, which I wish I had that metabolism now, but they said, you literally tried like everything. And I'm like, you guys didn't? And they're like, no, like we were full at a certain time. I ate like a lot. And I remember afterwards feeling, I mean, it was like probably 2 hours before my body felt like it was back on track. Like I was in a literal food coma. And, for some patients of mine, they've realized it's just too much, and with food, it's not like there's an avoidance of it, obviously. I mean, you're going to be confronting, but then the question is, what isn't really worth, like, do I have to go to a buffet? No, I mean, you can get away with not going to a buffet, but you do have to go to holiday gatherings. I wouldn't say, oh, don't go to any holiday gatherings because there's lots of food. We have to work at that. How do we regulate it? What are the tips? What are the strategies? From everything from supermarket shopping to eating and being aware of it. But coming from a perspective of not looking at yourself as like lacking willpower, like that's the word. We don't like that term. Like it's not an issue of willpower. The truth is we're just wired differently in the same way that no one, if you're someone that doesn't have any predisposition towards addiction, it must boggle your mind that people might drink or do drugs and when they know it's not good for them. But it's kind of easy to say that if you don't have that kind of wiring. It's just not part of your constitution. And I get that. I really do. I just don't like when people then make moral judgments about other people. But I get how that's hard for people to
they can't understand it. Yeah.
They can't understand it. Whereas that's part of my constitution. I understand that just implicitly, in terms, and food, again, is the easiest. It's just always there. I mean, we have to eat.
So can we get some tips for people with kids who are struggling with this, who, maybe they are coming to realize that that sort of responsive feeding model isn't working in their house? And is it ever, so say you've got the kid who loves spaghetti and meatballs, like we're not even talking about candy or cake or anything, but just will continue to serve themselves more and more spaghetti and meatballs when you think that they've probably had enough that they're not hungry anymore. How would you handle that as a parent? Like, is it ever okay to say, I think you've had enough? Because I think we're all so afraid of giving our kids, some sort of like shame or eating disorder that we're afraid to say, you've had enough. Is that okay to say? And what other things? I know you've said, get them to check in with themselves. What about saying like, wait 10 minutes and see if you still want it? Like it's so hard to navigate.
It is. And I think it's tough because, even saying, I think you've had enough. I mean, it's a fair statement. And at the same time, to some kids, what that can communicate is, you have to trust my experience of what you're eating over your own. And then for some kids, they can start depending on that, where it's like, okay, I'm just going to eat until somebody tells me to stop eating. And when that kid goes to college or even feel bad,
or even feel bad about themselves because like someone's, unintentionally or intentionally shaming them because they've eaten too much.
Exactly. And again, and of course, for parents, I again work with a lot of these kids where the parents, they are like, we have a family history of diabetes. I'm working with someone now, his uncle had his leg amputated because of diabetes. And the mom is very, very concerned. She's like, I do not want him to go down this path. I don't want him to die of a heart attack. Like, someone in the family did in their 50s, and she sees it. And at the same time, like you said, there's this line of, I don't want him to feel inferior or, less than, so it is really tough. So I think it starts with the sense of mindfulness of even starting to have these sort of strategies of, when you're eating, because people with ADHD tend to eat fast. By nature, I'm a fast eater. And so the faster we eat, the less we're really experiencing the food, the less our stomach and our brain has time to communicate that it's even satiated. And if we're looking for that dopamine release, the faster we eat, we're really not getting the full impact, which means what? We're going to have to eat more to just get that. So part of it is kind of training to say, okay, eat the food, but then put your fork down and we chew it and then we swallow it. And you could almost gamify it. And I've done this even in talks and conferences where I might use like a Hershey's Kiss or something and have people, just smell it, unwrap it, put it in their mouth without biting it, which is a challenge for me. Just let it actually dissolve. Like, how long does it actually take? But how do you experience that thing differently? One of the sort of games is, I'll have parents with their kids say, imagine like an alien from outer space came down and they had never had ravioli before. And you're eating it. You have to describe it to them because they don't maybe even eat food. How would you describe it? And like really kind of solidifying sort of this experience of, it's chewy and why do we even like certain foods? Like a lot of people might not know, the texture of this, or like, I love tomato sauce. Like I can literally just eat jars of tomato sauce. So to me, it's even less about the pasta and more about the sauce. Now, when I really understood that as an adult and I was watching sort of my food and wanting to eat healthier food, I realized I don't really miss, I eat, it's not like I don't eat pasta at all, but I really reduced my pasta intake. But I realized I don't really miss the pasta part. It's the sauce that I really like. So once I started mixing sauce with grilled chicken I was like, this is good. Even grilled vegetables in tomato sauce, like it works for me. So having kids sort of, do that. And then it could be, okay, you've eaten, a portion. Let's wait 5 minutes and, let's talk. Or maybe, if the kid like has a Rubik's Cube they're playing with, or it could be, why don't you do something? And then if in 5 minutes, or it could be 10 minutes, or depending on the age, 15 minutes. And if you're still hungry, then you can eat and, you'll eat something. And a lot of times, this is where we start to determine and realize, are we really hungry, or it's because it's there? Because for a lot of people, once they're on to the next thing, they're kind of done. Like, it's almost like, versus if you're really hungry, you could be on to the next thing and your stomach is like, oh no, I'm still, very hungry. And also, of course, this varies too, as you're getting close to like pubertal development. Kids eat, and especially, boys with, growth spurts, but girls need to eat and get their calories to have a normal menstrual cycle. Like that, not to be alarmed by the amount of food that a prepubertal child could, take in to support all of that growth that's happening in their bodies. But that's a big one. And that's something that has worked very well. Now, it could be hard for them to want to wait. But then this is where you might need, okay, why don't we, it could be playing a game, like 20 questions. I'm going to think of a person, as I do this with my kids, like, who am I? And I think they'd have to ask me 20 questions of yes, no questions. Are they someone in my school? Are they a neighbor? Are they a singer? And then time passes and then I'll say, okay, how are you feeling right now? And sometimes, the kids will say, and not just kids, adults too. I mean, we'll say, oh, I'm not as hungry. And then it could be, okay, is this something that maybe in an hour you could go an hour, and then an hour you can have a snack or something, and kind of just basically getting them outside this need of like this instant, like I must kind of have it now kind of thing. And that is, and it's a work in progress. That's the other thing. This won't be like, okay, we've done this for a week, now they have it. It's, for some people, it could take a long time to do it, and it might not come naturally, but they have to sort of, build on that. The other thing too is sometimes drinking a lot of water. That, when people, a lot of people with ADHD might not drink enough water and are just eating. And, water, number one, is important just in terms of hydration, but also water is very helpful in terms of appetite control too. Sometimes if we have room in our stomach, we're going to want to fill it with more food. And sometimes what we need is, more water in that way.
And how would you explain all of this to kids? Like, how would you talk about it in terms of, would you say, because you have ADHD, sometimes, your interoception isn't great, or, explain that in a kid-friendly way? Because some of these tips, I know people have said like, oh, these are like diet culture tips or whatever, like drinking a glass of water before you eat. And I do think that we're talking about a different beast here with somebody who's neurotypical and just trying to be thin versus somebody who has ADHD and trying to, eat in a healthy way that feels good for their body. So how would you talk about it in your family? Why you might do things differently than your friend's house does it?
Yeah, I think, I'm a very big proponent of the label of ADHD and using that terminology, and not from a perspective certainly of pathologizing, but really a perspective of, I feel personally, what a gift that I have this term where I could go to the Journal of Attention Disorders, which is a scientific journal just devoted to ADHD research, and learn about myself, learn about my brain. Like, I can Google ADHD and read things. I'm like, yep. So the benefit of the term is not meant to silo somebody or make someone feel less than or different in a bad way. it's acknowledging and validating, because we know we're different. We know it. Like, it's the ADHD is the worst kept secret. We sort of know it. So to have a name to it, and then say the power of this name is that we have a lot of experts and people who have done research that understand what is going to work best for people like us. And we can make do. Now it means, and and I always describe it to individuals like a coin. There's the heads and the tails. Like, there's the parts of this kind of brain. Like, I would not change my brain for anything, even though I could attribute the most frustrating, challenging, darkest things, in my life to the ADHD. And I can attribute the most amazing, fantastic, phenomenal things that I love about how I work and operate to that same sensibility. And so to say to kids, like, this is not, like, even in the ADHD community, you hear like, it's a gift. No, it's a curse. It's like this. It just is, as far as I'm concerned. Yes, it's frustrating and challenging, but honestly, it's so important to tell for, kids, everybody has to kind of be aware of what their brain is. We all do, really. I mean, just because somebody doesn't have ADHD, there are lots of people who don't have ADHD who struggle with food intake and obesity and eating disorders and such. I feel like there's almost this benefit that we have this name so that we have this like greater understanding and a sense of community. And the good news is that this is definitely different than 20 years ago. Is most of the young people I work with ADHD have a much less stigmatized view of ADHD than we saw even 20 years ago. So this is one of the few benefits. There are benefits to social media, but there are a lot of downsides to it. But one of the benefits is most of the kids I work with, they've heard it. They have friends who have ADHD and they'll get it. Like, I'll say like, yeah, maybe your friends with ADHD, they're like loud and maybe they don't have that sort of off button, but then there are other kids that clearly do. And it just means that, it's sort of like a different. And there are, again, the heads and the tails, of that. And now some parents might not want to say, oh, because of your ADHD. And I get that, every parent knows their child in that way. But it could still be the language of, we want you, I think the most important message, we want you to like food love food, like food, celebrate it. We want food to be a good thing, a fun thing. Now, with someone with ADHD, the truth is we want every meal to really be an event. And not every meal is going to be an event.
Oh my God. I'm not the only person who is like, I always think about what my meals are going to be and plan them out to get the most pleasure out of them.
Mm-hmm. Oh yeah. I'm going to New York in a couple of weeks for a conference. You best believe I know where I'm going to be eating. I mean, like, I'm so looking forward to that pizza place that's my favorite in New York. And so parents sometimes are like, my kid wants like every meal to be like amazing. And sometimes it's just going to be grilled cheese. Like, that's all it's going to be. So in one way, we want them to like food and all that. And at the same time, we don't want them to like worship food from the perspective of like, if I have a bad meal, my day is ruined, which some of the kids and adults I work with, that's how it feels, because they're like, I could have had a good meal. So we want you to like food, but also know that, some meals we have to eat because we just also need to nourish ourselves and we need nutrition and we want to be healthy. That's also super important. And why do we want to be healthy? And you have to put for kids in their terms. It's not just because, first, any 10-year-old doesn't imagine that they're ever going to be 40, number one. But especially an ADHD child can't even think, for the next week. So if, let's say you have a kid that's an athlete, to say, I want you to eat healthy because that's going to make you a faster runner. That's going to make your mind work better for baseball that you're interested in. If your child is, an artist, to say like being healthy, it has your body work better for you in this way and make it relevant to them. Mm-hmm. Because I know when I was in health class in 6th, 7th grade and they're talking about nutrition, I'm like, whoa, 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 whoa. Like, okay, yeah, we're supposed to eat fruits and vegetables, whatever. But if you had said to me, I don't know, like social interactions were really important to me. And I'm a big lover of music, that somehow like that eating more healthily, being more aware of that allows me to enhance my experience in a social realm or musical realm. Oh, well, that would have definitely landed on my ears in a very different, way. So making it very relevant in that kind of way. And also how being aware of how you talk about food and those things in front of your kids, even about your own stuff, because sometimes, and this is where it can lapse into sort of diet culture and harmful languages. And again, parents, we do the best that we can do. And some parents where they are saying all, these awesome things to their kids, but then their kids might hear them say, oh, I was bad today. I ate a cannoli. I was bad. I'm like, no. That language we want out the door. That is that harmful kind of language, because you're not a bad person because you indulged or overindulged in some ways. So being aware and having your kids hear that from you too, I think is important. Like I would say, I would verbalize out loud for the purposes of having my kids hear, like, I love pizza and I want a third slice, but I enjoy those two slices. And if I'm hungry later, I can have it but I'm not like preaching it to them because, who wants to be preached to? I'd say it out loud, wrap it up and model that so that they know this isn't just them, that they have to sort of do that. And the truth is that we all have to sort of be attentive to various things, and the truth is with bodies that there is like I didn't have to really pay attention to a lot of these things until from the perspective of like weight gain and things like that, because I had such a high metabolism where I remember I had a good friend growing up who, he was just built differently, than I did. So he was very aware, even though he had ADHD as well, but more aware of that because the consequences in his mind showed in a different way. And whereas there was, none of that until like later. To your point, that doesn't mean I was healthier necessarily, just because somebody has a fast metabolism. If you're eating like a high sugar, diet. Now, again, I was fed very well at home. Like I generally ate probably more nutritiously than a lot of my peers because of just most of my meals were at home. But certainly as I got older and I had more options, I didn't always take the healthy one. It was something I had to work on.
Yeah. And I cut you off before when you were starting to talk about one of the reasons why we don't want to be the person who's telling our child that they've had enough is exactly when they're not at home anymore and they haven't had that experience of checking in with their bodies and that interoception.
Yeah. And to be able to say, I notice you eat really fast is not a judgmental statement. It's like, and it's to say why is that an issue? And to ADHD, and sometimes parents might hear from parents of neurotypical kids. I certainly heard this sometimes of, oh, you explain too much to your kids. Like you just have to say you eat too fast, period. You need to slow down. That doesn't work with ADHD kids. It didn't work with me. I mean, I was the kind of kid, like I needed a justification. I was not difficult just for the purpose of being difficult. I just did not like the idea of a rule just because. I needed to know. I mean, and to credit, to my parents, and they would explain their justification. And 9 out of 10 times I was like, oh, okay, I get it. I understand that. Versus, so I would say to a child, oh, I want you to slow down. Number one, so you can enjoy the food better. Number two, it allows your stomach and your brain to communicate to let you know if you need more or less of something or something different. Sometimes it's not even about eating less food. It could be, oh, you've eaten a lot of the spaghetti, but you haven't eaten the meatballs, and meatballs have protein in it. And so it's not always about, oh, you need to eat less. It's, oh no, I want you to have a variety and the nutritional value of the food. So, oh, I want you to eat the meatballs because that has something in it that spaghetti doesn't have in it. Spaghetti has stuff that the meatballs don't. And so trying to like even have them aware of, those kinds of things, and to say, I want you to enjoy it. I want your body to, get the most of it. And frankly, I'm afraid of you choking. And that's not uncommon. I mean, I've worked with clients who their parents are like, my kid has choked dozens of times because they're just eating so fast. And I get that. And so it's putting it in that kind of language. So it's not like slow down, and those kinds of things, as if they're aware of it, because frankly, a lot of times they're not. I mean, I'm a very fast walker, like very fast walker. And my kids and whoever I'm with is like, you're walking so fast. And Sarah, I literally do not experience myself as walking fast. Like
Same.
yeah,
Fast
when,
walking, fast talking.
yeah, when I slow down to walk, I literally feel like I'm in slow motion. Like it feels so like, what are you talking about? Like, but I know I'm a mile away sometimes from other people. I just feel like other people are walking too
So
slow.
slowly. Sometimes I want to say to my husband, "You're talking so slowly. Can you just talk a little bit faster?"
Let's just move this. Exactly. I mean, I used to do improv comedy, which is a wonderful venue for people with ADHD, I have to say, because most of the people in that improv troupe probably have ADHD. It was so freeing, like you just have to respond, but at the same time, when I was in graduate school and training to be a psychologist, and my supervisors, we would audio record sessions that we would have with patients, and which was great. And my supervisors all gave me the same feedback. They independently would say, you're very empathic and caring, and you have the knowledge of the clinical, but you do not allow enough room for silences, and you talk very fast. And like, and they said this in a very kind way, with a certain intensity, that for a certain kind of person, if they're vulnerable, depressed, is going to be way like too much. And when I would hear that on the audio tape, I was like, oh my gosh, I didn't like, I would ask them a question. If they didn't respond right away, I'd be like, is it this? Could it be this? And they all, luckily, they understood I was coming from a place of, oh, you must not know, so let me help you. And I mean, this is like in my 20s that I would learn that not everyone processes things the same way that I do. So with eating, it's that same idea. I mean, most people are not even aware that they're eating as quickly as they are. So even saying slow down, it's more, oh, just, put your fork down while you're eating. Let's chew, take a couple sips of water. And it's not, and I understand the concern, because with diet culture, it is like, oh, have water so you won't eat the food. It's like, no, this is different. This is engendering mindfulness, mindful eating, which is very different than just the idea of dieting. And we don't
I
want
think
to
that's
diet.
the theme, right? That's the theme, is like trying to
Yes.
encourage mindfulness with your Hershey kiss, or the aliens, describing the food to the aliens. And also, I think you mentioned earlier, and when we were talking about, are you bored or are you hungry? Like, that's another thing that parents might ask kids too. Like, kids will be like, I'm hungry. Well, just check in with yourself. Maybe, are you bored or are you hungry? See if
Yes.
do something and see if you're still hungry in a few minutes.
Absolutely. And sometimes, even with that, like I'll have clients have a list of 3 to 5 things that, if anytime they're bored, what are 3 and 5? Because sometimes it's just, thinking, conjuring something up of like, what do I do? And so when they say they're hungry, their parents will say, okay, look at the list first of, 'cause this is assuming it's not near dinner time or a meal time or maybe they just ate a half hour ago. And that way the kid has this accessible list of things. And what the feedback I hear is, way more times than not, they get involved in that activity and they forgot that they were hungry. And then there are other times where it's like, yes, I have been playing with Legos and I'm kind of still hungry. Okay. I mean, my sense would be they're hungry.
Yeah.
Get a snack, get a cheese stick, get an apple, whatever. That's okay. So it's not about no, don't eat. It's around, let's be clear that that's really what your body is saying. Because with ADHD, and again, I think it's important to put this in a larger frame so it doesn't become shaming around food and bodies, is sometimes your ADHD is going to say, I want to go out with my friends when I have homework to do. And that just like, oh, I really need, and then it becomes, I need to go out with my friends. And, and that it's like, okay, well, Yeah, sometimes we do. Even if we have some work to do, we need like a mental health day or, we need that. And at the same time, ADHD, if we give it an inch, sometimes it could take 10 miles, really quickly. So it's being aware. It's never a one size fits all or black and white. Like I don't ever want to encourage that because again, sometimes you are hungry, even though you just ate, because your body could be growing and developing, and we want to honor that because we want that growth to happen. But I certainly know, like at nighttime, for a lot of the adults I work with, they're snacking and they're like, they're like, I know I'm not hungry. I just don't have enough to do, and when I'm sitting and watching TV, it's not enough to watch TV. I need more stimulation. And so one of this adult male patient I'm working with now, he folds his laundry, which he hated to do beforehand, but he does it while watching TV. So he's like, oh, this is great because I'm not even focused on the fact that I'm folding laundry, which I hated doing. And I realized I'm not really hungry for Doritos because I'm engaging my hands and I'm busy doing something. So it almost solved like two, issues in that way. So it's also being aware of how we pair food with certain things. And, we see it like the movies, like, of course, you have popcorn at the movie, but do we really need to eat popcorn? Like, it could be fun. Again, like if somebody's like, oh, this is a fun experience. Okay, that's great. But it's different than somebody saying, no, I'm hungry. I'm at the movies. I'm hungry. It's like, no, maybe you're not. Maybe there are these conditioned sort of, stimuli and expectations that you have around it.
And the point is too, like, it's okay to sometimes just like, well, I'm not hungry, but I really want to have popcorn at the movies. As long as you're like fun. You're making a conscious decision, right?
Exactly. And that distinction is super important because there are times when, yes, you might not be hungry. And I would not say, therefore, you shouldn't eat at all. It's like, no, sometimes it's fun, to just like you go to the movie. It's fun to have your jujubes or, whatever kind of candy, that you like. That's fine as long as, but it's being aware of that. It's that mindfulness. And that's a muscle basically that people with ADHD are flexing for their whole lives. I mean, really, to really master.
Well, this has been so helpful personally and professionally. Just the last question that I ask all my podcast guests, which you didn't get this because you were a summit guest before, but if you could go back in time to your younger parent self, what advice would you give yourself?
To my younger parent self?
Mm-hmm.
Oh,
it can do with anything, not even just what we're talking about today, but any advice that you would give yourself as a parent if you could go back in time.
I would say, honestly, the thing that comes to mind for me is to be more attentive to my sleep because, I mean, as we know, people with ADHD have, issues with sleep and such. And I think I looked at sleep as very disposable and making me more available to my children, my family, my work in some ways, and taking really not fully recognizing like I do now how that does not make me fully present if I'm not sleeping well. And I'm not talking about the sleep that, we all are sleep deprived when our kids are infants and such like that. But even, really valuing sleep as self-care in that way and realizing like I could have felt more present than, I did just by, operating on very suboptimal sleep.
Yeah, that is, I think that's really good for parents to hear because I think sometimes it's so hard. You are tempted to stay up later after your kids go to bed to get that, your me time or watch the Netflix with your partner or something. But generally, I think on the balance, quality of life improves when you've gotten 8 to 9 hours of sleep, which is what the research is showing, right? Is 8 to 9 hours is what most adults.
Which is a challenge for a lot of, folks with ADHD and definitely a lifelong challenge for me. Maybe we could talk about that in another podcast.
Yeah.
Sleep is a whole other
one
animal.
Challenge I don't have. I love my 8 to 9 hours of sleep a night.
Oh yeah. See, I'm a poster child of sleep disorders and sleep problems.
Yeah. Well, thank you so much. This has been so helpful and it's been so wonderful to talk to you again.
Same here. It's always a pleasure, Sarah.
Thank you. Thanks for listening to this week's episode. I hope you found this conversation insightful and exactly what you needed in this moment. Be sure to subscribe to the show on your favorite podcast platform and leave us a rating and review on Apple Podcasts. Remember that I'm rooting for you. I see you out there showing up for your kids and doing the best you can. Sending hugs over the airwaves today. Hang in there. You've got this.